Today I'm gonna talk to you about new regenerative techniques that can help you to recover your tendons without surgery in many cases. I'm a licensed sports physical therapist. I've been working as an international sports physical therapist for 18 years now, and I'm completing my PhD in biomedicine and health science. I practice snowboard, surfing, mountain biking, and I also do CrossFit and trail running. And I'm an active soiler. This experience allows me to better understand my patients. So now we are going to see an example of the treatment of an injured tendon on the shoulder.
Hey, so hello John.
Hello Raf.
So my problem is that I was crossing a pedestrian way.
Yeah.
And suddenly a car hit me, and since then I have pain in my shoulder if I try to do this movement.
Yeah.
So up to this point it's okay, but then I can't lift it, whereas on the other side I can really lift all the way.
Okay.
And also I noticed that this movement, like I can't go higher than this, and on the other side it goes all the way, and so I feel very weak as well.
It sounds like you have like a rotator cuff injury. For me, it's a clear case of injury in the supraspinatus. We're gonna confirm with the radiology,
Okay.
and let's make a point after that. We are going to have a look at the radiologic report. The MRI shows an injury of the enthesis of the supraspinatus muscle that was affecting more than 50% of the thickness of the tendon. But there was no retraction. The infraspinatus tendon is in a good state, the subscapularis is in a good state, but there is an inflammation of the subacromial bursa. I'll be using later on Intratisular Percutaneous Electrolisis, which is an innovative technique in the field of regenerative therapy to optimize the recovery process,
Okay.
not only in terms of time reduction, but actually in terms of tissue quality. So the next step is gonna be we're gonna do a ultrasound scan. I'm gonna define the target tissues to treat, and then we're gonna proceed to the treatment.
Okay, so I strip and we start.
Whenever you want. We're gonna do a little ultrasound scan. You're gonna come here to see exactly where the damage was done.
Okay.
Around this area here. Okay. You can see very close to the bone here how the cortical, the border here is damaged, and you can see this little gap.
In black, right?
Exactly. Okay.
Okay.
So now with the IP, we're gonna come here with the needle and we're gonna stimulate this area. I'm going to proceed with a little intervention. Okay, so you can see the needle. We're in the deltoid area. We're gonna trespass the sheet, and now I'm going exactly straight away into the injured tissue. And you can see in the image how this white area is actually a product of the electrolysis itself. It's gonna accumulate into the tissue. So now we're gonna improve your pain and mobility. We're gonna do a percutaneous neuromodulation of suprascapular nerve, the suprascapular hole. So I'm gonna, with the needle, I'm gonna directly through the actual muscle of the supraspinatus, going deep. I'm gonna try to activate actually with some electricity, and if you're in the right point, we're gonna see some activation of the shoulder. It's gonna try to move it itself. Okay. Just let me know if it's too hard.
Okay.
I don't know if you can observe the muscle contraction.
I can.
It's very local.
Contracting. Am I like a frog in biology?
Exactly.
Okay.
It's always very important to treat surrounding structures. Just not treat the tendon, but treat everything. Obviously, the movement and load, they're gonna be the most important factors after this. Okay.
Okay.
Well, good, Raf.
Thank you.
I think you're done for today. Thanks to you.
So after this first intervention, I continued the treatment for about 8 weeks. John gave me isometric exercises to do, like going on a wall, pushing through the elbow without any movement and holding, or pushing through the hand with some rotation, again an isometric exercise. Then we built up a bit with some load, like very small load, going up and going to the place where there is pain, going a little lower, holding for a while. And then we built up to some dynamic exercises with a band, for example. Same thing, going close to the place where the pain is, but not like we should barely feel the pain. And then some very specific exercises for the supraspinatus, like the empty can with the thumb down, with a very light band, extremely flexible. And then I would help my injured arm with the other one, go there, hold for a while, go back slowly. And same thing, go up where it's not too painful, hold, and going down for some reps. And then after these, we moved to some shoulder stability exercises, for example with rings or with a ball like this, while staying in a very stable, secure position. And then the result after 8 weeks of proper care, including proper nutrition, proper sleep, some massages, the exercises, and EPI. So the result of all of this is that I recovered full mobility with this movement, whereas I couldn't do it at all at the beginning. And also before I couldn't go further than this, and now pain-free, I have full range of motion. And the only exercise that remains without load but painful is the empty can with the thumb down. If I go all the way to here, no problem. Then from about here up to there, it's painful, and then it's okay. So we are still working on that. And I can do about 20 push-ups with elbow tucked without problem. Now let's meet John again to see how this tendon looks.
Today we are 8 weeks after the accident. Same picture of the supraspinatus tendon. We can see how the tissue is evolving. So here we can observe in this hypoechogenic area how there is some white points around here. This is the tissue that is healing, but still not completely healed yet. I'm trying to treat these hypoechogenic areas, so the dark areas of the tissue of the supraspinatus tendon, and moving to different parts. So this is the first shot. In here, I'm going to come out a little bit. I'm going to touch a bit in the interface between the deltoid and the supraspinatus. Okay. So we're gonna what you see here on the image, this white line is a needle that has an electrical current passing through. And we are trying to reach or damage areas to stimulate them and produce the intratisular electrolysis.
So I hope you like this video. You can find more information in the link provided in the description. Bye bye.